Development of medicines tailored to children is important because children are not many adults. Their physiology is different from that of adults. You can't take an adult tablet, break it into two halves and give a half to children. Especially for bitter drugs, you need better taste masking of the drugs so that they are more acceptable and palatable to children. If children don't take medicines, they're not cured. This was recognized when the World Health Assembly passed a key resolution back in 2007 for the Better Medicines for Children campaign that led to development of and accelerated the development of pediatric medicines. If you take malaria as an example, according to the latest World Malaria Report back in 2021, over 80% of malaria cases are children under 5 years in the sub-Saharan Africa. So it tells you that there is a large vulnerable population out there that requires medicines that are tailored to them. We should focus on children as the target population during our clinical development. MMB has had a good track record in developing pediatric medicines with various pharma partners, starting over a decade ago with Novartis, where we co-developed the artemether infantry dispersible tablet targeted for children. And more recently, we worked with GSK to develop a pediatric formulation for ternoquin for relapse prevention of Plasmodium vivax. In the space of chemo prevention, we also worked with various manufacturers to develop SPAQ, sulfaroxine, pyrimethamine, and amodiaquine combination to combat or to protect them from malaria as part of the seasonal malaria campaign. We are also developing pediatric medicines for all new chemical entities that we are developing. More recently, we're working with Novartis to develop a formulation of artemether infantry dispersible tablet that's targeted for children under 5 kilos who are currently not served by the existing formulation. GAPF is an initiative that is hosted under the WHO. MMB is a member of GAPF, much like many other organizations like TB Alliance, DNDi, RBM Partnership to End Malaria, and various other organizations. UNICEF is another member, and the goal is to develop pediatric formulations of the existing drugs where they're lacking, and to accelerate the development of those pediatric medicines and make them more affordable in the low to middle income countries. I hope someday that we will have the required medicines to treat as well as prevent malaria in this vulnerable population. The drugs that we are developing and the formulations that we are developing, I hope, will someday lead to 0 cases of malaria in children.